All right, here we are. My name is Mark Funkhouser, and we're back. I'm back with Lisa Seif, my good friend and former colleague. And this is the third of what we hope to be maybe 4 sessions. Could be more down the road, but we had planned on that. Did want to remind everybody that Lisa wrote a book and started doing some promotion on that. And actually, I think that's how we got to do this. I started seeing some of those promotions, and her and I had been talking about doing something for a long time. We've actually done quite a bit over the years, but it's been more actually in practice and working with clients and things like that. So Lisa, remind us before we get started the name of your book and how that got started, and then we'll move into the
Oh,
next topic.
sure. Well, I've always wanted to write. I come from a line of writers, and I've always wanted to write. Journalism was my first major, so it's always been on my bucket list, but there's just no time. It
Yeah.
takes time. So I went to a conference, and the big thing now is quotes. And I've always loved quotes in the recovery meetings. I love the one-liners, the fake it till you make it, one day at a time, just reprogramming my brain with those quotes. So I had an opportunity to write on quotes, and then journaling was another important skill and tool I used in the beginning of my own journey. So the book Think and Grow Sober is on Amazon, and it's strictly quotes and then a chance to journal about those quotes. And during COVID, I just, realized how busy our brains are and our lives are. I swear we're an ADHD culture. So I went back to those quotes and that journaling because that just gets you centered. It's healthy for the brain and spirit to just get focused on something. And I realized it during COVID, how out of focus and the priorities. So the book just kind of came at the right time. I had the time with COVID. And it took off. And the next one will be Think and Grow Sober for women. And then the next one after that will be Think and Grow Sober just for men. So I hope to do a series. Thanks, Mark, for flashlighting on that.
Well, it's important work. And I think we could probably do a series on just the quotes. And I know you've been doing some highlights on LinkedIn. Anybody wants to see some of the videos that you've put on LinkedIn, it's little promos for each segment and excerpts. And we also we did some earlier conversations, 2 of them actually, on things like process addictions and activity addictions that are just substance addictions. Also in substitution, we talked about how people sort of substitute when they come in to recovery, and then we focused on health and wellness, which we may come back to because it's such an important thing in life, whether you're in recovery or not. Health and wellness is I think it's a growing trend. It seems like it's coming back into vogue. But
it's definitely in the mainstream vocabulary.
Well, and the pandemic actually reminded us about that. About staying healthy and well, and with emotional and mental health as well. And then we also talked about the paths of recovery. So what I want to do now is I want us to talk a little bit about our work. You and I met in the work realm, and I was working in probation and juvenile probation. I went on to do some adult probation, and then you were actually a therapist at the time, I think, working at Mulberry Center and working for Youth First, and then you actually got into being director of drug court for, I believe it was when you were working in Vandenberg, and you went to Warwick, and so you had quite a journey there in problem solving courts when they were really kind of coming on, especially in Indiana. And so, but I want to and for me, I got into the adult realm, and then also in peer recovery and training people on how to work with people and actually get paid for it. So what I want to talk about is, and this could really apply to anybody in the workforce, but because it happens, whether you're in recovery or not, sometimes I think I use that term more loosely than others do. I think sometimes recovery is it's about growth oriented life and trying to be healthy, especially after we get through the early days. But But I want to talk about the tricks of the trade a little bit, the parallels sometimes in actually working in recovery and then working in the field, and also maybe the need for separation and how we can balance those things. So let's talk about that. How did you navigate that? Because you started out in your own recovery, and I presume you actually either went back to school or you were already in the field. I don't recall your history there, but and how did you navigate that over the years? Because you changed a lot with regard to the roles you had, but your recovery was pretty consistent throughout that. So tell me a little bit about how you navigated all that.
Oh my God, Mark, that could take just
Yeah.
to give you a quick little snapshot. When I first got in the field in the early 80s, if you were recovering, it was considered a credential. And you could take a class and
Mm.
get certified as a drug and alcohol counselor, CADAC, certified alcohol and drug abuse counselor. And until managed care in the early 90s, you were considered a credentialed part of the disciplinary team because you brought the recovery knowledge and experience to the therapists, to the theologists, to the medical people. So we were just as important a part of the team in the profession as anyone else. In fact, on our name tags, they didn't even have what the alphabet next to the name was because we all wanted to be equal. So using my recovery as a tool in early profession was good, but I had to get a lot of clinical supervision because we can tend to over tell our stories and over tell our experiences. And when we're professionals, we're not there to tell our stuff. We're there to hear theirs and help them process theirs. Well, once managed care came, the CADACs were kicked out because they were not reimbursed. So you had all
Okay.
these great old timers that had a knowledge of people and of the recovery of emotional sobriety, and they had to lose their jobs because the managed care would not reimburse for that. So they tried to make them technicians then instead, but and they were still important on the team. But I saw, and my clinical supervisor said, get back to school, Lisa, because if you don't, you'll just stay in the technician role the rest of your life, which really I was very happy with that hat. But once managed care came, it changed everything. And then I went to Parkside at Mulberry Center. And they, in the training, they said we could not share our recovery at all with the patients because when we do that, we are creating a divisiveness because all the patients will want to talk to Mark. They won't want to talk to Dr. So-and-so or to the minister or to the nurse. The only one that understands me is Lisa because I know she's in recovery. I don't want to hear what you have to say. So it started to change because that team approach needed to be dignified and the recovering person needed to just be part of that because other people have just as much to offer as the recovering person. So in a way, I liked that. Now, if they asked us, Lisa, are you in recovery? I'd just say, you know what? We're here to talk about you. But sometimes you get cornered and our answer is always, yes, I'm in recovery, happy to be so. Now let's get back to talking about you. You did not share it, but they could tell. And when we did family programs, the families could tell, but it wasn't fair to the rest of the team to disclose that. So it really took my recovery and the strengths of that and professionalized it. And I'm grateful. At first, I didn't like it. I thought that's a bunch of crap. Why are we ashamed of our disease? No, it had nothing to do with that. It had to do with being fair and on the team. So it really professionalized me to shift into that.
Wow.
And from that day forth, now I'm not real quick in my professional world to say I'm in recovery, but there's other ways to let them know where to find paradise.
Yeah. You could write the book on the history of peer recovery, though, because that's changed.
Oh, they're so important. They're like the old techs now. Everybody
Now,
wants peer coaches.
Now,
It's coming
if
back.
you're paid as a certified peer specialist or a peer coach, it's almost a requirement. that you
Yeah.
actually share part of your story. So
Yeah.
it's
So it's
interesting
kind
to
of
see how
swinging
that's
back.
changed. Yeah.
It's swinging back.
And like you said, and this is what I've always said, is that there are many therapists in the world that are um, good at what they do, and they're not
Yes.
in recovery. You
Yes.
know,
Look at
that you don't have to be.
EMDR. Look at
Yeah,
EMDR.
yeah.
Most folks that do it are not in recovery, but they're really good
Mhm.
at working with that trauma, and then we can bring the other elements of how we can
Mhm.
deal with trauma. Yeah.
Yeah,
So it's
you don't
and
have
the
to be
peer
in recovery,
coaches.
but
Well, the peer coaches are so instrumental, but that's their identified role to
mhm.
help them get jobs, to help them get social skills, to help them with if they get snagged up in a relationship. Sponsors are just to help us with the steps. Peer
Yeah,
coaches do more of the life skill stuff.
yeah, yeah. And I think it's about identification, and then you can still have value for the other professionals that. And I think one of the big things when I was doing some training of peer recovery people back in Indiana, we always had to make sure that the peer specialist wasn't used as a spy, you know,
Yeah.
and to put them in a situation. But then there are certain things they had to divulge, like if you told somebody that you were at risk of harm to yourself or somebody else,
Oh, yeah.
that's a
That's
serious
a
thing.
federal
So
law.
yeah, so those are boundaries. Well, so let's talk about how have you maintained your own health and wellness over the years? You know, and I don't know about you, but for me, it's kind of ebb and flowed. I've not been like there's not been some perfect nirvana as I've
Mhm.
worked in the field over the years. But so how has that worked for you?
I knew that getting clean and sober for myself was the tip of the iceberg.
Hmm.
And for a couple of years, I knew I just had to focus on that. But then emotional sobriety. And now the research has shown us that when people get clean and sober or abstinent in their process addictions, the anxiety and depression goes up.
Hmm.
So I
Hmm.
think I just am grateful I had good people around me that I could be honest with and authentic with, that I did not feel good emotionally. I woke up at 101 fever for the first few years emotionally. I was functional, but I did
Hmm.
not feel good for a long time, Mark, and I'm grateful I was
Hmm.
able to let go of my tough front enough and that the
Yeah.
people in the rooms could tell when something was wrong with me. That's why it was important to have a sponsor and home group. But
Hmm.
once I
Hmm.
got my degrees and got alphabet next to my name and started
Hmm.
getting good jobs, and it seemed I started to withdraw a little bit again behind the wall because I
Hmm.
was afraid. You know, what if they know this? What if
Hmm.
they know my
Hmm.
brother-in-law committed suicide? What if they know,
Hmm. Hmm.
I punched a wall? So it got tougher for me to be as authentic as I feel like I was in the beginning days. So I
Hmm.
started going to therapy because I know it's important that I stay healthy no matter what length I have to go to. And it may not
Hmm.
be going, I don't disclose stuff in meetings anymore, and my sponsor and I are more really good friends now, and maybe that's
Yeah.
not the right person to go to. I needed
Hmm.
and then now, thank God, I can tell when it's a spiritual muscle that needs fixed, whether it's a psychological muscle, an emotional muscle, a
Hmm.
physical muscle. If I'm overeating again, something's
Hmm.
going on.
Hmm.
Is it spiritual?
Hmm.
Is it and I thank God for you and people that I've known that keep saying, hey, here's a new highway. This can
Hmm.
help you find some peace. And I go for it. I am not shy to run
That's
after
great.
the solution.
Yeah.
So that's how I
Well,
keep it separate.
yeah, and it is a matter of life and death in a lot of
Yes.
ways. Like at first, I've often thought that we get clean physically and chemically. You know, nowadays, you know, it's different with harm reduction, things like that. But physically first, then emotionally, and then spiritually. That's how we but but it's the other way around. Once it goes spiritually, then we're emotional wreck, and then physically we could potentially relapse. So it's really just the opposite. And so the gauge, like you said, so and I think there's some real humility in you saying, and I've done this too. I've been in and out of therapy over the years with divorce and
Oh, sure.
career stress and just my own stuff. And so you got to be able to walk the walk and talk the talk at the same time. And so we'll use the very services that we refer people to, right? Not necessarily the same ones, but I mean, because who am I to sit here and tell you that you need to go, talk to somebody when I'm sitting here suffering, and not willing to do that. And so I think there's some real humility in that. And it's not really for anybody else anyway. It's for us, because
Yes.
it's a quality of life thing. It's like one thing I've realized is that
Oh, my dog's
because
going off in the report.
oh yeah,
Hold on, Mark.
that's all right. That's all right. Yeah, take a break.
Go ahead. I'm sorry. Abe was
No,
saying
that's okay.
hello to the crowd.
That's all right. Mine is I think taking a nap. So
You
so yeah,
know what,
so I
Mark?
think
I want to say you and Judge Meyer and Judge Trockman really helped me, because I got way more anxious internally about my ability to help people when I started working for the courts. It was a dilemma for me, quite frankly. And the director at the time of the drug court was a very punitive person. And back then, but you modeled for me. You just keep planting the seeds. You're the farmer. We may not see them sprout. You can't kill anybody. If the judge puts them in jail, it's not. I really, really struggled, if you remember, when I first started working for the courts, from the treatment model and trying to do rehabilitation with offenders. And you and I did the Outward Bound with the kids, and there was still such a punitive. If they smoked cigarettes, one of my best friends that worked with me, Gloria, may she rest in peace, thought they should be sanctioned and kicked out of the program because they smoked cigarettes. You remember I'd come to you just, how do I deal with it? And I really started to question, what is this profession? How can it, the courts definitely challenged me. I have to say that. I'm grateful I'm not in that system now, and that people like you and Judge Trockman are, because it takes people that do understand wellness from a different perspective.
Well, being treatment oriented and more into, no, you have to, the punishment really, it's like what we always said was that people tend to punish themselves more than we could ever do that anyway.
Right.
But
Right.
at some point, you have to have sanctions and things like that. And
and I had to learn that.
I was always, like I was very treatment oriented and probably sometimes too lenient, and that so I had to, kind of balance that. But
Me too.
sometimes, like, people even in the probation realm were called social workers, like that was some kind of a negative thing. And because we actually cared about people, and
we're
we were
soft on crime.
Yeah, well, they even said, "What, hug a
thug."
Yeah. So but I think the problem solving courts have actually turned that around quite a bit.
They have.
And so I think that's helped, because I think we realize that you have to meet people where they are and take them where they want to go. We may have some idea, but if you don't meet people where they are and try to understand why they're doing what they're doing, or what happened to them, and listen, then you don't have any idea what they really need. And I might think I know what they need all day long, but it doesn't matter what I think, about that in some ways, because if they don't believe it, they're not going anywhere. Matter of fact, they're going the other way. If I try to, shove that down somebody's throat or try to browbeat people with it, it just doesn't work that way. So let's talk a little bit about burnout and vicarious and secondary trauma, and then we'll move into trauma in general. I'm not an expert on trauma by any means, and you've got a therapy background and more into psychology and social work, but what I do know is that, and healthcare is another example. It's like when we work with people who have trauma and suffering and pain and things like that, it really transfers. It sort of affects us in a vicarious way, because we're in that with them to some degree. And so let's talk about you know, separating that to some degree. How do you separate that? You know, in Al-Anon, they always said, you know, um, detach with love, you know, and from a professional standpoint, you have to, um, you know, it's a little different, you know, you have to set boundaries and things like that. But so how have you set those boundaries, and how have you um, dealt with your own, you know, vicarious or secondary?
That again, is continually to be a work in progress for me. Now that I'm at the Women's Hospital with Deaconess, working with these women in postpartum depression,
Mm,
uh, traumatized at the fear of hurting their babies, it's uncovering a whole other realm of trauma than what I've
mhm,
dealt with in my career.
mhm,
So again, it's uncovering that, it's throwing back the layers of the onion, but it's like you said, it's so individualized. And Mark, I've always been one that will cry with my patients if
mhm,
they're
mhm.
hurting. And I have a lot of moms that have lost their kids to overdose, that
Oh yeah.
people that males and females that have been raped financially, sexually, emotionally. You can't not feel
Mhm.
that, but I
Right,
don't have to carry it.
right.
So, you know, I have learned, and I think I attribute it to our program, our own work at further
Mhm,
development. I want to be the best leader I can be,
mhm,
understanding emotional and cultural intelligence.
mhm,
I think it's just staying not a step ahead, but right with them,
mhm,
and being willing to be in my own vulnerability. And sometimes I have to say, I don't know how to,
mhm,
I don't know the answer.
mhm,
It's complex grief. It's not the stages of grief Elizabeth Kubler-Ross taught us.
mhm,
With trauma, it's complex grief. And I think it just sometimes comes in waves,
mhm,
especially if you've experienced it. But I'm able to acknowledge it. And I think professionally, that's the most important thing for me, is that I can acknowledge what's going on with me physically and emotionally so that I could
mhm,
stay a leader and not
mhm,
go down. But I'm not afraid to let people know, gosh, you have the
mhm.
bravery of a soldier I've never met. What some of these people have been through, what some of
Right.
those kids in our Outward Bound program told us.
Mhm,
Houses that I've seen that people were raised in,
mhm.
it's traumatizing to me, quite frankly. But I
Yeah.
don't keep it. I don't carry it, but I acknowledge it with them, and
Mhm.
I think we have to stay authentic and vulnerable in our profession.
Yeah. So being present, I think, in the
Yeah,
humility that you speak of as you work through your own stuff, and
yeah.
and you know, we can't totally identify either because we haven't been there and done that, or we can't share everything, you know, obviously from a professional standpoint, but
It
being
wouldn't be
present.
fair. It wouldn't be fair to them. I was traumatized when I was 10 years
Mhm,
old. And then the way my
mhm,
family and community responded to it
mhm.
traumatized me even more.
Yeah.
The way girls were seen as a
Mhm,
gender
mhm.
traumatized it more when I got in high school. But I can't
Yeah.
tell my patients that's not fair. They need to be able to tell their story. Did you, without somebody saying, well, I walked to school in the snow. I
Yeah.
mean, that's
Yeah.
discounting. And that's where parents, well meaning parents, go wrong, because
Yeah.
that's not the way to respond to our folks, is to
No.
tell them, you know what I mean? So that's
Yeah.
a response that's not healthy, for them to hear our sad, pitiful stories. I have other
Right.
places to go for that.
Well, and even in a personal conversation, they say it's not a good idea to go directly to, and we tend to do that too much in some of the programs, is that we'll go right
Yes,
into our sharing our experience, but they say it's not a good idea to, because you're usurping
their
their ability
experience.
to be there. And as a professional, and I'm not a therapist, but I worked with a lot of people over the years in different ways, and actually, I believe that listening and being intentional and attentive and present, um,
Yes.
and just acknowledging their pain. And
Yeah.
if, since I'm not a therapist, if they, a lot of people needed therapy, so we would refer them, to deeper work and things. And so I think if, as people in the professional realm in various ways, I think it's very important that we do our own work, like you talked about, because they call a lot of us wounded healers, and if we don't tend to our own wounds, or if we continue to re-traumatize and re-wound, ourselves, or allow other people to do that to us, then we really can't be as effective as we can, and we can't really even be present to
No.
clients or participants or whatever it is, or we can't really be who we need to be for our other friends and family and relationships and things like that. So
Yeah, and if we're burned out, we're going to go into that halt again. We're
mhm,
too hungry, angry, lonely, or tired. And
mhm,
then we make very impulsive, bad decisions. And I've seen good therapists burn out and do
yep,
unethical things, and
oh
it's
yeah,
not because they're not a good therapist. It's because they burned out and they became unethical.
yeah,
It's easy to do because we're in a very intimate relationship with people.
yeah. There could be some transfer there. They say
Right,
that
right.
if you don't transcend or transform your pain, you will transmit it,
Or
and
transfer it. Yes,
yeah,
yes,
transfer it. So
yes.
so let's talk a little bit about. Let's just go ahead and move into talking about um, anything else related to trauma. What and then we'll take a break, but I wanted to talk a little bit about historical or ancestral or collective trauma. I just finished watching part of a series with Thomas Hübel, who's a German therapist, and Gabor Mate was in there, and
Hmm.
Besser Vanderhoort. I forget how you say his
Yeah,
name, but he's the guy that,
that's so.
because they talk about, no, the body keeps the score. I've heard that in my yoga teacher training, it was the issues are in the tissues, or that the our
Oh, that's
bio
great.
our biology is our biography. It speaks,
Ooh,
yeah, yeah,
ooh,
yeah.
I'm hearing some things tonight. That's
Yeah,
great.
well, and that's in the yogi realm, because when we do yoga, there's a lot of movement, and we're and and things kind of get stuck in our body, and it's not just
Yes.
physical pain, it's emotional pain and things like that. And so um, I'm wondering, what do you, when you work with clients who have trauma and things, and you've talked a little bit about what you do, what else do you encourage them to do, how to work through that aside from talk therapy?
I always encourage them to get on a YouTube or a Google if I think they're ready. We worked with Terry Kellogg and Marvel Harrison and
Hmm.
John Bradshaw in the early
Hmm.
days.
Yeah.
Raquel Lerner, Claudia Black. I
Hmm.
think our job, you and me, is to determine and assess what level of care, trauma informed care, can we deliver? What dosage do we need to give this person? Because one
Hmm.
size doesn't fit all, right?
Hmm. Hmm.
So if they are just early in uncovering some of their trauma and talking about it, I probably wouldn't send them to someone that I think is severely traumatized recently, you
Yep.
know? So it's
Right.
pretty much individualizing it and determining the dosage, but letting them also guide me on what they feel they're ready for. Because there's places you can go for deeper work.
Hmm.
EMDR is deeper work. What
Hmm.
Terry Kellogg and Marvel did at Mulberry was very deep, and with some folks, market re-traumatized them. One dentist
Hmm.
committed suicide after coming out of that.
Oh
So
wow.
you have to really, really
Hmm.
know how to assess, and then
Hmm.
if it's
Hmm.
cognitive behavior therapy, solution focused therapy, you and I can do that in our sleep. with people. We can walk them through those skills and techniques. If it's a little deeper, or if they want to do a little more work outside of our office or outside of the courtroom, YouTube and Google have fantastic meditations, mindfulness practices, breathing, self-soothing, bathing, music, journaling. Sometimes I'll have them bring their pictures in of when they were like 0 to 10 and start reflecting on their life growing up. And oh my God, that can unleash all kinds of things. So there's a lot of photography is a great way of getting things loosened up in people if they're ready for that. So gosh, there's just no excuse for us practitioners to let anybody stay stuck there.
Yeah.
You know, but sometimes people need to stay in their trauma for a while and really get in touch with it, embrace it. It's part of our experience.
Yeah.
So,
Well, and you mentioned journaling and getting,
yes.
I know a lot of groups that I've done over the years with men's work and you know, it seems like the body work in the body, and I heard this in the collective trauma summit that I listened to, and I know my brother is deeply into somatic work, the inquiry, and it seems like somatic work, work in the body, and it kind of goes along with yoga, and so it, you know, Zig Ziglar used to say we need to check up from the neck up, you know, so that's true. That's all true, but what about the rest of the body?
And I think that's where we're headed now to understand the important linkage between the body and the mind.
And connecting
the
body, you know, that's where I come from. Like I moved from some Western, you know, study into Eastern, more holistic stuff with Reiki and Chini Song and Karsai and massage therapy if it's done in a healthy way, and even cranial sacral stuff. You know, a lot of alternative functional medicine techniques. Even I've had chiropractors who are really more holistic and not just into cracking your back or whatever, and including acupuncture. You know, I do acupuncture like every 3 weeks, and using essential oils and all of that, and you know, doing retreats and spa, having a spa day, you know, could be, I think part of it is self-nurture, self care. And it, you know, it obviously goes beyond that for some of the people that you see, or some of the people I've seen over the years, that, and even ourselves, perhaps we may need, you know, professional help, outpatient. Sometimes it requires inpatient work,
absolutely,
clinical, you know, stuff. Even some people need, you know, medication and things like that. So that's different. But I think once we get stabilized and get some of the deeper work, you know, get through some of the deeper work, like you said, you can't bypass that. You have to be in it and feel the feelings and hope, you know, realize they won't kill us. Although if we don't address those things, you know, it could do us harm in the long run. So anyway, I would strongly recommend, you know, that people try some of those other avenues, not in lieu of, you know, professional therapy if they need it, but in complementary way, or in a supplemental way. So I want to wrap this session up. It's been pretty heavy, actually.
It's been great always talking to you, Mark. Wonderful.
Lots of good stuff. I think it's been good. It's been kind of a reunion for you and I, and reminiscing a little bit, and also not just thinking about the historical nature of it, but you know, where things have gone in the field and how much has changed, you know, really, I think, for the positive. So we're going to wrap up this session, and I'm going to we're going to come back for one more in the near future, and we're going to be talking about family systems, family in general, and that can be very painful for a lot of people. You know, you talked about it earlier. Sometimes we've seen people, you know, die from in different ways. You know, suicide is a big issue that we need to be watching for people, and overdose is definitely one. And we may actually talk about some other things, maybe how the pandemic and how COVID has affected us with regard to mental health and some of those things we talked about. So Lisa, thank you so much.
Thank you, Mark. Great. Here we are on another adventure-based challenge.
Yeah, I like that.
Thank you.
Bye.